Black folks, the new federal Medicaid funding cuts in the HR 1 bill, they passed it. And most people still think it only affects your coverage. It doesn't, y'all. It's going to affect whether you'll be able to see your provider, continue seeing them, or it's going to affect your loved one trying to get into the nursing home. Let me tell y'all what's going to happen. See, these funding changes are going to start to roll out pretty soon this year in 2026 before July. And many states adjust provider payments at the start of their fiscal year, which for a lot of states, that's July 1st. That's why offices begin changing what Medicaid they accept before people ever hear about any eligibility changes. See, when the states receive less Medicaid money, the first thing that changes is how much doctors get paid to see each Medicaid patients. And when reimbursement drops, offices stop accepting Medicaid quietly. They're not going to send you a notice. They're not going to warn you. They're just going to stop scheduling you to see your doctors. That's when people start realizing, oh, it's changes. Oh, we're not taking Medicaid anymore. Or they may say something like, oh, well, we're only accepting schedules from existing Medicaid patients. We're not taking anybody new. Or they may say something like, the specialist is booked up for months and months and months, so you're not going to be able to get in. Y'all, this is going to also affect families with loved ones in nursing homes or preparing for nursing home placement. See, because nursing homes heavily rely on Medicaid funding for long term. See, Medicaid kick in when Medicare stop. Y'all get what I'm saying? It's going to be fewer Medicaid beds available and longer placement wait lists at these long-term care facilities. And it's going to be even more pressure to private pay before Medicaid approval. So some states, y'all, they're going to also increase eligibility reviews and require additional paperwork and tighten renewal standards sooner than people expected. So if you're delaying any type of medical visits, specialist referrals, imaging appointments, mental health care, or you're trying to secure Medicaid placement for a loved one in a nursing home, do it now. July is right around the corner. Because historically, Medicaid doesn't become harder to qualify for first, it becomes harder to use first.
Okay, so I want to just go over what happened with that letter I got yesterday about my Medicaid. I had no idea that my account was being, they called it a review. However, when I logged into my account online last night, it said that I did not need to reapply until February of next year. So when they tell you that these Medicaid cuts are not going to happen until the end of next year, they're full of shit. Just so we're clear, they are reviewing people's accounts and kicking people off Medicaid right now. And I know this because I'm one of those people. So if you are on any of these programs and you have access online, if I were you, my best advice to you would be to always log on and look and see what's going on with your account.
Very true.
I had no idea that a new application had been submitted for me because I did not submit it. I don't need to until February, but they've already kicked me off the program. So, and my son, who was a 19-year-old high school senior, they have put him on his own account as an adult. He is also autistic, and his Medicaid ends October 1st. So there you have it. There you have the big, beautiful pile of shit bill in a nutshell. And this is going to happen to millions of people, and it has already started. Thanks, MAGA.
They said the cuts wouldn't happen yet, but people have already been losing coverage and have been for a while. This video is a little bit older by a handful of months here, and people still have been losing coverages. Healthcare has been only getting worse. You know, they lied. They lied.
In America right now, millions of elders and disabled citizens are facing a healthcare crisis that many still do not fully understand. Behind closed committee doors in Washington, lawmakers have already approved major Medicaid and Medicare cuts as part of what Republicans are calling one big beautiful bill. This is truth verdict. Relax and grab your coffee as I break it down. Special credits to Stitch's video used in this documentary.
Cuts in the budget that affect you. 60% of all people who are on Medicaid will lose coverage because they're also on Medicare. So there's a lot of different types of coverage of the Medicaid they're going to lose because they're on Medicare. There are millions of people with dual enrollment in both Medicare and Medicaid because they're eligible for that because they're elderly and disabled. And Medicaid helps these individuals offset the costs of what Medicare costs because Medicare is not free. There's a monthly premium payment. It's like $185. There's prescription payments. There's services that Medicaid offers for these individuals that Medicare does not offer. And there's long-term care. There's just so much that Medicaid helps these individuals receive, and pay for because Medicare doesn't do these things. Okay, let's go through these cuts. And it's important to remember, when I use the term Medicaid, I mean any state insurance. Because in California, in various states, Medicaid is called something different. It's also really important to remember that when I say Medicaid won't pay for this or Medicaid won't do this, I am talking about the money that the federal government is putting in for Medicaid and what the federal government will no longer pay for. Now, individual states will make their own decisions. Individual states may pick up some of these costs. Their Medicaid program, they get a certain amount from Medicaid, and they might say, oh, some of this Medicaid money the federal government gave us is going to go towards one of these cuts that the federal government made. Okay? So it's going to vary state to state. And if you're in a Republican state, well, you can just throw all hope out the window, in my opinion. Let's get through the cuts. Medicaid will no longer provide cost-sharing assistance. This is the assistance that helps you pay for your Medicare monthly premium of $185. This is prescription assistance. This is any out-of-pocket cost assistance. Medicaid won't cover that anymore. The Republicans say this will save a lot of money because people aren't going to get the services anymore. So in essence, it's going to save the federal government money with Medicare. Because if you're not going to get the services using your Medicare because you can't afford it because you're not getting the cost-sharing assistance from Medicaid anymore, well, then it saves the government additional money with their Medicare. Which type of services specifically does Medicaid cover that Medicare does not? Let's go through them. Dental services, vision care, vision services, medical equipment like wheelchairs, transportation to appointments, long-term care, Medicare monthly premiums, as I said, and of course, help with substance abuse care as well. For individuals who have Medicare and Medicaid, Medicaid is the primary payer for those people who are in long-term care facilities like nursing homes. There's 63 to 70% of individuals in nursing homes in the United States. This is according to Medicare Rights Center last year, where Medicaid was the primary payer. So 63 to 70% of individuals in nursing homes who have Medicare and Medicaid will now not be able to afford this, and families, if they have families, will have to pick up the cost. You will have to start paying your Medicare monthly premiums of $185. Those will be directly taken out of your Social Security checks. If you're elderly, it'll be taken out of your Social Security. If you're disabled, it will be taken out of your disability checks. Automatic. $185 per month. The low-income subsidy program and the extra help program will be gone. Elderly and disabled will pay more out of pocket for everything. This includes, but is not limited to, Medicare premiums, co-pays, prescriptions, home and community-based services. Now, these are a lot of cuts, and it's a lot of money extra that's going to have to come out of individuals who are elderly and disabled pockets. It's going to depend, like I said, on your state and how they decide to spend the money that they get from Medicaid from the federal government. It's going to depend on your state as to what happens. You might have extra help in your state. You might not have to pay your monthly Medicare premium if you come from a blue state. Okay? All of what I said in this video goes into effect October 1st, 2027. Okay? And as far as where it's going right now, today is May 16th. The House Budget Committee is taking this particular piece of legislation, as well as all the pieces of legislation that are in this one big beautiful bill, and they're putting it together from all these different committees who passed all these pieces of legislation. They're putting it together to make it one big beautiful bill, and then the House floor and the Senate floor will separately and individually, these Congress members will vote on this one big beautiful bill, and if they both pass it, it will go to Trump and he'll sign it. They want all this done by July. As far as, when immediate implementation of some of these provisions begin. However, everything I just talked about in this video, as I said, doesn't go into effect until October 1st, 2027. Now, I have some resources for you. Save the video or write this stuff down. These are resources for individuals who are on Medicare and Medicaid, and where you can just get information at any time in your life. These are really good resources to have, okay? Medicare Rights Center. You can go online and Google them. Justice and Aging, and the Centers for Medicare and Medicaid. These three resources have so much information that pertain to you.
For ordinary Americans, especially seniors, disabled individuals, and low-income families, critics say this legislation could become one of the most devastating healthcare change in modern history. According to healthcare advocates and policy experts, nearly 60% of people currently receiving Medicare support could lose critical coverage because they are also enrolled in Medicare. These Americans are known as dual eligibility, people who qualify for both Medicare and Medicaid due to age, disability, or several financial hardship. And for many of them, Medicaid is not just an extra help, it is survival. Medicare alone does not cover everything, despite what many Americans believe. Medicare is not free. Seniors and disabled individuals still face monthly premiums, prescription drug cost, co-pay, out-of-pocket expensive, and medical services that Medicaid simply does not pay for. That's where Medicaid comes in. For years, Medicaid has helped millions of elders and disabled Americans cover costs that Medicare leaves behind. Medicaid helps pay Medicare monthly premiums. It helps with prescription medication. It helps with transportation to medical appointments. It helps provide wheelchair and medical equipment. It covers dental services, vision care, long-time nursing home care, and substance abuse treatment. Without Medicaid assistance, many Americans could not be able to avoid health care at all. But under the proposed changes now moving through Congress, much of this assistance could disappear. Critics warn that Medicaid will no longer provide cost-sharing assistance for many dual enrollment recipients. That millions of senior and disabled individuals may suddenly become responsible for paying their own Medicare premium, prescription costs, and out-of-pocket healthcare expenses. And supporters of the court openly argue that this will save the federal government money. Why? Because if people cannot afford to use their Medicare benefit anymore, then they simply will not use it as many healthcare services. In other words, freer doctor visitation, freer prescription, freer treatment, and freer long-term care services means lower government spending. But healthcare advocates say human costs could be catastrophic. One of the biggest concerns involves nursing home and long-term care facilities across the United States. According to Healthcare Advocates Organization, Medicare currently serves as the primary payer for between 63% and 70% of the nursing home residents who rely on both Medicare and Medicaid. That means millions of elders Americans living in nursing homes depend directly on Medicaid funding to survive. If funding disappears, family may suddenly face impossible bill for long-term care. Many simply will not be able to avoid it. And it does not stop there. The low-income subsidiary program and the extra help program, both designed to assist low-income Medicare recipients with medication and healthcare costs, are also reportedly facing elimination under portion of this legislation. For elders and disabled Americans already struggling financially, this could mean dramatically higher out-of-pocket expenses for prescription, treatment, and daily care needs. Now, here is where things become even more complicated. Healthcare experts say that the impact may be very depending on where you live. Some states may choose to continue offering additional support using their own budget. States with strong social programs may help residents offset some of these losses, but other states may not. So depending on your state's government, some Americans may keep certain protection while others lose them entirely. Right now, legislation is moving rapidly through Congress. By May 16, the House Budget Committee is expected to combine multiple approved committee proposals into one massive package. The bill Republicans are proudly called the Big Beautiful Bill. After that, both the House floor and Senate floor will vote separately on the legislation. If both chambers approve it, the bill will be then head to President Donald Trump for signature. Lawmakers reportedly want this entire process completed by July, and critics say the speeding is intentional. Because once Americans fully understand what this court could mean for elders, parents, disabled relatives, nursing home residents, and low-income families, public backlash could explode nationwide. Healthcare advocates are now urging citizens to take immediate action. They are asking America to contact members of Congress, especially Republican lawmakers supporting the legislation, and pressure them to vote against the bill before it reaches the president's desk. Critics argue that it will not simply a budget debate. They say this is a fight over whether Americans' elder and disabled population will still have access to avoidable health care and long-term care support in the future. If you or someone you know depend on Medicare or Medicaid, experts strongly recommend researching how these proposals change may affect your state, especially. Helpful resources include Medicare Rights Center, Justice in Aging, and Center for Medicaid and Medicare Services, which provide updated information and guidance for beneficiaries and family. Special credits go to the Stitches video and creator whose clip are used in this documentary. If you believe stories like this deserve more attention, make sure you like, share, and subscribe to Truth's Verdict for more documentary exposing the story shaping America and the world.